committee will come to order. The chair recognizes herself for 5 minutes for an opening statement. As we prepare to return to our districts for the August work period, there is one topic of conversation that will be sure to arise whether I am in Williamson, Montgomery, or Henderson counties, all areas that are familiar and known to our witness today. Of the folks I hear from most when it comes to Obamacare, I'd say that they are probably in two camps. Those who aren't quite sure what Obamacare will mean for them and their families, and those who have studied the law and its policies and are opposed to what it will do. It is the uncertainty of the law that most concerns me. Uncertainty about how much individuals' health insurance costs are going up to comply with the laws and the mandates and the taxes. Uncertainty about what new and additional expenses employers must take on as a result of the law. And business uncertainty for the numerous medical device companies that call Tennessee home due to the medical device tax. It appears you have a lot of work to do by October 1 and the end of the year, so much so that Secretary Sebelius even acknowledged having, and I'm quoting her, very tight deadlines. I voted yes on the Fairness for American Families Act earlier this month to delay the individual mandate for 1 year, a mandate supported by just 12% of the Americans, despite being told over and over by the president that if you like what you have, you can keep it, and that health care premiums would go down on average $2,500, individuals in Tennessee are seeing the opposite. Based on the exhaustive work by our staff here at committee, our report found that for those in the individual market in Tennessee, premium increases of 49 to 54% could be expected, as well as increases of 35% in the small group market. Unfortunately, these increases should surprise no one. If something is taxed, and there's $165 billion in taxes and fees on health plans, plans sold on the federal exchanges, drug manufacturers, and medical devices, and then loaded down with mandates, which guaranteed issue, community rating, essential health benefit requirements, it is absolutely going to be more expensive. According to a recent Gallup poll, more than 40% of the small business owners have frozen hiring. 19% have reduced the number of employees, and 9% of the over 600 employers surveyed say that Obamacare would be good for their business, as opposed to 48% that say it would be bad. At this time, I yield my remaining time to the chairman of the full committee, Mr. Upton. Governor, we appreciate that. We'll begin our questions, and I will begin by yielding myself 5 minutes. And I want to start by talking with you about fairness, which is what I hear from my constituents. At this point, what they're doing is coming in to our meetings with papers in hand, and they can actually document the higher premiums, the disruptions in their existing coverage, and show me where it is due to the Affordable Care Act or Obamacare. And while they are looking, many of them are looking for some reprieve from the taxes, the penalties, and the increased cost, you and your employees at CMS are fully protected, and you are eligible to keep the insurance coverage that you have, which you have taxpayer dollars that are paying for that insurance. So I want to ask you this. If you are able, are you willing to enroll yourself in an exchange plan come October 1?
If I were eligible for an exchange plan, I would be happy to enroll in an exchange plan.
Should CMS employees who are all responsible for implementing this law be required to enroll in the same plans that Americans are being forced to enroll in these exchanges?
Chairman Blackburn, I would say that if Congress decides that the employees of CMS should be enrolled in exchanges, that the CMS employees would support that.
Would you support a bill to that effect? For you and all CMS employees?
I would be happy to work with you on the development of a bill, and we can discuss that.
Do you think all government employees, whether they're at Treasury, HHS, Labor, OPM, White House that they should be subject to the same plans and premiums that our constituents are having to face?
Well, I will remind you that if you look at the Affordable Care Act, if you remember, there is a large number of your
We
constituents
remember well.
that are not subject to the Affordable Care Act. Remember,
That was not my question. And would you support having all these government officials having to enroll in an exchange plan? Everybody involved in implementing this?
to the extent that if you look at the exchanges offer full coverage at reasonable prices. We're promoting competition. We're promoting transparency, and of
We're
course,
in the dingle room, so I'm going to ask a dingle question. Yes or no? Would you support it?
yes, I would support it.
Okay, thank you. CMS has awarded Equifax a contract to conduct income verification of potential applicants seeking an exchange subsidy. So what is the estimated percentage of potential applications where income data can actually be verified by Equifax given the volume of data that it currently controls?
I think there's a lot of confusion about income verification, so I'd like to spend a couple of moments talking about that from the standpoint of the federal exchange. If you look at what happens when an individual fills out an application and they record their income, there is a check, 100% check against IRS. There is also a 100% check against Equifax. If those two obviously match, the individual proceeds. If there is a discrepancy, then we begin an intervention where individuals bring in pay
Okay,
stubs.
let me ask you this then. Are you all going to have other contractors that are there to assist in verification of potential enrollees? And I'm asking you this because the self-attestation provisions are of tremendous concern to us, especially to me. And you're familiar with TennCare and what happened there with self-attestation and Governor Bredesen's efforts to go pull all of these individuals off that program. So, you know, tell me how you're planning to handle that.
We will do a 100% review of self-attestation
Immediately?
immediately.
Okay.
Now, individuals, when I say immediately, it obviously is a process where individuals bring in pay stubs, this sort of information, so that we work with an enrollment and eligibility worker. In the meantime, those individuals are
So 100% review means of all of their self-declarations. You're going to go back through every bit of that.
That's correct.
By when? If not immediately, by when?
So if you remember, what we have in regulation is if an individual attests to their income, we enroll them for what they're eligible for. We have up to 90 days to reconcile that.
So you foresee having all of this completed on each enrollee within 90 days?
Absolutely.
And if someone is committing fraud, how quickly will you remove them?
They will, if someone is incorrect, right, as soon as we find out that there is a problem, if they're not eligible for tax credits, they would be removed immediately.
My time has expired. At this time, I yield 5 minutes to Mr. White.